Hi, I'm Dr. Loel Payne with Tidewater Orthopaedic Associates in Hampton, Williamsburg, and Suffolk, Virginia. I do a lot of shoulder surgeries, and one of the more common questions I get asked is, how do we take care of the pain afterwards? Shoulder surgery hurts. There's no question about it. And so I'm going to go over with you a few tips, how to manage the pain, how I like to approach it, the medicines that you're going to get for the surgery, how to take them, and hopefully that's going to make you get through it a little bit easier. So first of all, in the old days, we used to just give everybody a ton of Percocet, a lot of narcotics. Here, take all these pain medicines and get through it. We realize that's not a great approach. Narcotics have a lot of side effects. Everyone is aware of the potential addiction with narcotics. They also constipate you. They cause nausea and hallucinations in a lot of people. So we're going to try to limit the narcotics as much as we can, but we still want to control the pain. And so the way that we do that is called a multimodal approach, meaning multiple different ways of attacking the pain, and they all work in combination. So one of the most important ways to try to control the pain afterwards is the use of ice. Unfortunately, most insurance companies don't cover ice packs or the ice machines that you'll see in physical therapy. So you're going to have to decide how much do you want to spend on getting a nice ice pack. It can be something as simple as a frozen bag of peas. You can lay those on top of the shoulder. It conforms around the shoulder, and it does a pretty good job of helping keeping it cold. It doesn't want to stay in position very well. You could sometimes use an ace bandage to wrap around that and then around your waist to hold it in place. Keep it on for about 20 minutes until the peas have started to thaw. Put it back in the freezer, give yourself a 20-30 minute break, and then you can put it back on again. So that's the simple, cheap option. They also sell a nice ice pack that you can buy online for about $25. Some of the local pharmacies, I think, will also provide it. And that's something, again, you just put it in the freezer, but it has little Velcro straps so it conforms a little bit better around the shoulder. Same idea, you keep it on for about 20, maybe 30 minutes. Put something underneath it, a loose cloth, washcloth, something like that, just to keep you from getting frostbite if it happens to stay on for too long. Then we kind of go up to the next level. They sell ice coolers that you fill up the cooler with ice water. It then circulates that fluid into a gel pack that's wrapped around the shoulder. You keep refilling the ice cooler. You're not going to have as much of the problems with it leaking, and the gel pads fit pretty well. Here's an example of kind of how a Velcro pad would wrap around the shoulder. So you can put it on top of the shoulder. It's going to have the Velcro straps to hold it in place. It's going to conform both to the front, the side, the back. It's going to have a connection where the ice cooler hoses attach. It relies on gravity to drain that into the shoulder. You can't really set the temperature a whole lot. It's just going to be based on whatever ice water is in the cooler. You can get those online for about $125, $150 is another option. The final option is you also have the ability of renting the machines that you'll see in physical therapy. I brought one in, it's called a Game Ready, that we have here in our physical therapy department. This does not require filling it up with water. It is a coolant that's already in there. You can turn it on and literally set the temperature to what you want, how cold you want it, for how long you want it. It also gives a nice compression to the shoulder. It attaches the same way to the pad, so you can just sit there. You're not constantly rechanging the ice. Unfortunately, it's also more expensive. It's going to rent. We'll let you know how the companies around it will rent those, but it's probably going to be in the neighborhood of a couple $100 a week. It's not cheap, but by far the most effective if we're going to try to get something that's really cold. So that's the first mode of what we're going to do to try to control the pain. The second thing that's going to be important is the proper use of a sling. There's a video on how to make sure the sling is going to fit comfortably. Check that out. At night, you're going to be much more comfortable sleeping sitting up. We know that after shoulder injuries or shoulder surgeries, it hurts a lot more if you lay flat. So we tend to tell people after you've had surgery on the shoulder, sleep upright. get a recliner, prop up with some pillows in bed. You can buy a nice foam wedge that'll help support you and keep you upright. That's also going to be much better to give you some sleep at night. You're going to want to sleep with the sling on just to give it some support. Now we get into the different medications. I want to show you my recommendation for how to take it. So we use different medications because they all work differently to try to control the pain. We're not going to rely just on the narcotics. So we use several different things. You'll be given a prescription for some of them. Some of them are over the counter. You're going to be taking Tylenol around the clock. You're also going to be taking an anti-inflammatory like ibuprofen around the clock. You're going to have a prescription for the pain medicine to use as needed. Some people will also be on some other medications if they've had a larger surgery like a shoulder replacement, and I'll go over those. So let's say you have surgery in the morning. We typically will do a nerve block. It means the anesthesiologist gives you a shot of Novocaine at the base of the neck. It numbs up the whole shoulder and arm. It's going to stay numb, hopefully 12 to 24 hours. Everybody's a little different. It's always a little hard to predict when it may wear off. But you should be able to go home comfortably, not hurting. So you have surgery early morning. Surgery's an hour, maybe a little bit more. You stay in the recovery room another 45 minutes, and then you're going home. So you're home by late morning. So our nurses at the surgery center or at the hospital will tell you how to start taking the pain medication based on what you were given while you were there. So let's say you get home around 11 o'clock in the morning, get something to eat. You're not going to be typically hurting at all. The nerve block's going to still be keeping the shoulder nice and numb. Go ahead and start getting some food in your system so you can start taking some medicine. So let's say you do that around late morning. So I like to do it as a chart so that you can keep track of when you're due for your next medication. So let's say you have had, a late breakfast, lunch. It's now going to be 12 p.m. when you're going to first start taking some pain medicine. When you first get home and have had some food in your stomach. The first medicine is going to be the Tylenol. I want you taking Tylenol around the clock. The easiest way to do it is to get the 500 milligram tablets. That's the extra strength Tylenol. And you're going to take 2 pills every 8 hours. So we're going to do it at 12 o'clock, the 2 Tylenol. The exception is if you have liver problems, don't take Tylenol. The maximum dose of Tylenol that I really want you taking is 3,000 milligrams a day, max. So 2, you're going to take every 8 hours. So you're going to take 2 Tylenol. Also, you're going to start taking an anti-inflammatory. I tend to prefer ibuprofen because it's on the 8-hour schedule like the Tylenol is. It's easier to remember to kind of how you're going to stagger that out. You can take Tylenol and ibuprofen together. I think it's a little bit easier if you stagger them. And so since you're still not going to be hurting at 12 o'clock, we're just getting the Tylenol on board, we can wait a little bit longer to take the ibuprofen. And so we'll start that 4 hours later at 4 p.m. That way we're going to be staggering them in between. So at 4 p.m., we're going to take the ibuprofen. Advil or ibuprofen over the counter is 200 milligrams, and we're going to want to take at least 3 to 4 of those, which is 600 to 800 milligram. 3 to 4 pills. You may have a prescription for ibuprofen that is 800 milligrams. If that's the case, you're only taking 1. If you're using over the counter, 3 or 4 pills depending on your size. If you tend to be a little smaller, I would just do the 3. If you're a bigger guy, do the 4. And you're going to do those also every 8 hours. So let's finish up the rest of our schedule. We're going to put these at 4-hour intervals. So 8 p.m., 12 midnight, yes, wake up at night to take your pain medicine. 4 a.m. if you really need it, and then we're back to 8 a.m. So we're going to have a schedule of about every 4 hours taking different medications. So the Tylenol I said was every 8 hours. So we're going to start that at 12. We're going to take 2 pills again at 8 p.m. We're going to take 2 pills again around 4 a.m. that first night, especially if we're awake, just to keep that on an 8-hour schedule. We're going to alternate the ibuprofen in between. The 600 to 800 milligrams ibuprofen would come at midnight, which is 8 hours after the 4 p.m. dose. And then again, we're going to pick it back up again at 8 a.m. So the Tylenol and the ibuprofen, we're taking around the clock, whether you feel like you need it or not, for those at least first 3 to 4 days. And if you stagger them like that, you've always got something in your system that's really helping with the pain. So it's okay even if they happen to coincide, you can take them at the same time, that's not a problem. I think it's a little easier if you stagger it like that, and if you have it written down as a schedule, it kind of keeps it a little bit easier on track. I have many people who have shoulder surgery, even sometimes hip replacement, knee replacement, get by just with that and never end up with a narcotic. We use the narcotic as our backup. So I tend to use oxycodone as the narcotic. It's one of the stronger ones. So we want to have something that's really going to control the pain as we need to. It will tell you on the bottle, it is 1 to 2 pills every 4 hours as needed. 4 hours as needed. So we can plug that anywhere into these 4-hour blocks as we need to, but you don't have to always take them. So you're not going to be hurting at 12 o'clock when you first get home. Don't take the oxycodone. Probably still not hurting at 4 p.m. Still, the nerve block is going to last, like I said, 12, hopefully even 24 hours. But if you're starting to go to bed, say 8 o'clock, been a longer day, I would take at least one of them prior to going to bed. One before bed. If you're already starting to hurt a little bit, it is okay to do 2. And then I would start that on an every 4-hour basis as you need to. What many people find is they'll go ahead and they'll start on this, and after a couple of days realize they don't need it, and you can back off again. But we're going to tell you, you'll hear this multiple times after the surgery, stay ahead of the pain. So take the pain medication early on, like before you go to bed, even if you're not hurting. That way you're not going to wake up in the middle of the night in severe pain. You've already got some pain medication on board. So go ahead and at least take one before you go to bed. If you wake up and you're hurting, say even 2 hours later, you could go ahead and take the second. And then that's going to be 4 hours later that you're going to be able to take 1 or 2 more. Everybody's a little different for how they react to that. That's why we kind of give you that variability. Do 1, maybe you need a little more, take 2. You're still doing the Tylenol and ibuprofen. Again, it's okay if the oxycodone matches the same time as either the Tylenol, the ibuprofen, or both. You could take all 3. They're acting differently. It's okay to do that. So that's how you're going to manage the pain level, is with those 3 medications. The oxycodone's kind of the breakthrough one. Most people, again, we're trying to get you off of that as soon as we can, relying more on the Tylenol and the ibuprofen. If things still aren't working out so well with taking the 1 or 2 oxycodone, let us know. There's some other things we can try to do to help you through that. Most of the time, that's not going to be the case. The other medications that you may get as well, depending on your history of how you react to anesthesia or what type of surgery you're having. It could be something for nausea, most likely used with the brand name called Zofran. It's also on an 8-hour routine. It's going to be more frequently needed if you're on the oxycodone. So oftentimes people are taking a Zofran at about the same time that they're doing the oxycodone. So those could be every 4 hours. You can do the oxycodone. The Zofran, though, is every 8 hours. So that's going to have to be spaced out 8 hours apart for the Zofran. If you're having a shoulder replacement and are going home, You're also probably going to go home with an antibiotic, usually also on an 8-hour schedule. It can match up anywhere when you first get started. We'll let you know when you leave the hospital what time to start taking your antibiotic. It can match up with any of those other medications also. Sometimes also with shoulder replacements, we'll have people take an aspirin a day just to prevent blood clots. That can fall in line anywhere as well on that list. So a lot of different medications. They work differently. They're going to help control the pain. We're not just relying on that oxycodone. We want to use the other things to try to control the pain better and hopefully make it a much easier recovery. When you're on the oxycodone, remember the side effects. Nausea, if you have a problem with nausea already with anesthesia and with taking pain medication, let us know prior to the surgery when you have your history and physical done. We'll prescribe a prescription for the nausea medication. We don't prescribe that for everyone. Oxycodone also will cause constipation. If you're on it, make sure you're taking something for the constipation. That's over the counter, Miralax, milk of magnesia, prune juice, something that's going to help with the constipation. It also will sedate you. Some people will have some even hallucinations with oxycodone type side effects. Be careful. You can't drive if you're on the oxycodone, so you don't do it. It's driving under the influence. Some people can drive with a sling on if you feel comfortable driving just with one arm. You can't do it though if you're on the oxycodone. You can just with the Tylenol and the ibuprofen. So hopefully that answers a lot of the questions for how to manage pain. If you're having issues, concerns, certainly feel free to give us a call and we'll try to help you through it.